recently honored Dr. Hassan Azzazi for his outstanding efforts to push forward the Egyptian society through the promotion of entrepreneurship in the field of science and technology. Dr. Azzazi is a professor of chemistry at the AUC and is also the director of the chemistry graduate program and the leader of novel diagnostics and therapeutics research group at Yusuf Jamil Science and Technology Research Center. Dr. Hassan Azzazi, Professor of Chemistry at the AUC, thank you so much for being with us this morning and congratulations.
Thank you very much.
Thank you very much indeed. Doctor, of course, you were recently honored for your research development initiatives. Could you tell us a bit more about this initiative that you've embarked on?
Almost 3 years ago, I established the Novel Diagnostics and Therapeutics Research Group within Yusuf Jamil Science and Technology Research Center at the American University in Cairo. The mission of this group in a nutshell is to offer alternative medical innovative solutions to existing health problems in Egypt. We embarked upon the hepatitis C virus, which infects over maybe 10 millions in Egypt and 200 millions around the globe. And we attempted to use cutting-edge technology in nanotechnology and in biotechnology and bioinformatics to develop novel diagnostic tests as well as novel therapeutic strategies against this disease. The diagnostic arm was probably more developed and more successful in developing a prototype for detection of hepatitis C virus RNA in blood in a very short time, and in a way that is much less expensive than existing methodology. And we hope that we will be able to develop this prototype further to reach a marketing kit that can be utilized to help manage the problem of hepatitis C virus in Egypt and around the globe.
Okay. Dr. Hassan Azzazi, it is said that one of the main pillars for our development here in Egypt is scientific research. Now, as a scientist, and after the reward you received, or the honor you received, could you give us a quick or very general outline regarding how do you see, how can we have this roadmap for scientific roadmap for Egypt in the coming phase?
The only way for Egypt, I don't think there are many alternatives. I think I strongly believe that the only way for Egypt to develop and progress and become competitive country globally is by linking academic research and industry. This is a very crucial link that should be emphasized upon.
That means it has never been there before.
It has been there at a very, very minimal scale. I think it's a very weak relationship, not a very robust one. And again, there is a segregation between academic research and industrial needs, and of course
the application needs.
And the application, exactly. So there is a crucial need. I mean, this is a very crucial, and I can just emphasize it, cannot find the strong word to highlight this. It is super important that we direct basic research in university to meet market demands and the industrial needs. We need to develop we need to build an economy that is based on innovation and technology. We cannot depend on an economy that is based on services, for example. Services are good and can contribute to economy, but then to build a strong economy that is competitive globally, we need to build this economy on the know-how and technology and innovation. And all of these exist within academic institutions, universities and higher institute of research and research centers. So how can we get these institutions to become engaged in supporting economic development? How can we make our graduate students or students that graduate from university, graduate or undergraduate, become competitive and have the right skills needed by the market? How can we empower our graduates to become entrepreneurs? And this is the subject of probably of this, meaning that, they are expert in chemistry or in physics or engineering or medicine or whatever, but then they need or lack these soft skills. How can they identify an opportunity within their area of expertise? And then how can they mobilize resources to get this idea or this opportunity into a product, into a company that can move or mobilize to the market, and then support the economy. This is, I mean, if you look at the European Union, for example, 70% probably, or somewhere around this figure, of income of EU is based on SME, small and medium enterprises. We need to do this in Egypt. But again, not based in addition to services, which I think there are many industries and small enterprises in Egypt that are based on services. We need to also do the same SMEs, but for technology and for innovation, based on IP, intellectual property, and novel ideas. Our graduate students should be empowered and should be taught how to do this. They are the ones who are going to pull this country and the economy and push it forward and make it competitive globally, and we need to do this. And actually, part of my involvement with the European Training Foundation is to introduce entrepreneurship education in higher education.
Indeed, Doctor, that actually leads me to my next question.
Yes.
You participated in 2009-2010 in a pilot project with the European Training Foundation to study the effect of entrepreneurship skills on college students. Could you tell us a bit about some of your findings, and more importantly, how to implement, or have they been implemented on college students here in Egypt?
Right. In late 2008 and 2009, 2010, I have been recruited by the European Training Foundation as a national expert for Egypt in entrepreneurship education. And the purpose of this exercise is to develop a set of indicators that could be used as either a roadmap or an assessment tool to assess implementation of entrepreneurship education in higher education. How to teach our students, again, how to develop a business plan, how to mobilize resources, how to identify resources, how to build a team, how to start up their own business or their own companies. This was an effort that is being supported by the countries of the southern Mediterranean, all countries of the southern, starting from Morocco up to Egypt and Lebanon and so on, in addition to Balkan countries like Albania, Bosnia-Herzegovina, and other Balkan countries. And we have developed a tool, which is essentially the set of indicators to assess entrepreneurship education. And we have did an exercise in Egypt at the American University in Cairo. And as a result of this exercise, we have now introduced entrepreneurship courses at the American University in Cairo. And I believe other Egyptian universities, national universities, have also introduced entrepreneurship courses in their relative schools or centers, depends on the situation or the university. I believe also that the Ministry of Higher Education have at least agreed on a strategy to introduce entrepreneurship education across the board in pre-university and post-university education, which is also very important, again, to empower our graduates. We do not want our graduates to, okay, I have a bachelor degree, give me a job. Yes, I have a bachelor degree, I may be able to find a job, or I may be an entrepreneur, a natural entrepreneur, or entrepreneur by education, and I can start my own business and my own enterprise.
Okay. Dr. Azazé, what kind of projects are you working on right now?
At the American University in Cairo, I have actually implemented entrepreneur principle in my research group. So right now, as I mentioned earlier in the session, that we have already developed a prototype for detection of hepatitis C virus RNA in blood, and this test is probably cost around 1/10 of the cost of current tests in the market that are available commercially, and at the same time, we can get the result in a very short time.
Would you elaborate on this project, because we need more elaboration for the ordinary?
Sure. We have actually discovered that gold nanoparticles could be
in a simplified way, of course.
Exactly.
Okay.
Gold nanoparticles are essentially gold, but at the nanoscale. 1 nanometer is 1 over a billion of a meter. So it's a very tiny particles. They have a nice red, bright color in solution. But when they start aggregate around any target, the color of the solution change from red to blue. We have adopted this interesting phenomena to make this gold nanoparticle recognize hepatitis C virus in serum. And if the virus is there, the RNA of the virus is there, this particle, we taught them how to recognize the virus and then aggregate the virus. So the color of the solution changed from red to blue. This gives me a visual colorimetric signal that the virus is there. And this is the basis of our test that we have developed.
So there are medical application for...
Absolutely.
So it's a new diagnostics.
It's a new novel diagnostics, and actually shaking the principle of detection in the entire clinical laboratory diagnostic arena, because detection of RNA or nucleic acid of any virus or bacteria is based upon usually amplification of this RNA or DNA, which takes longer time and needs very sophisticated equipment. We have utilized nanoparticle to do the same thing, but with a very simple technique that does not need sophisticated equipment, that does not need much longer time, that does not need highly trained personnel, and achieve the same result. Like right now, to diagnose a patient with hepatitis C virus, you need to do an antibody test first, and if this antibody test is positive, then you ask the patient to do something called PCR to amplify the genome of HCV and detect the virus, which takes maybe between 2 to 3 or 4 days to get the result, and maybe around 500 pounds. We can get the same result in 1 hour with 50 pounds using gold nanoparticles. And again, this is the new revolution, the nanotechnology revolution. So essentially now this is something that we are living as we speak, and there are ample opportunities to revolutionize medicine, to revolutionize energy, to revolutionize environmental protection using these two tools that are given to us by nanotechnology.
Very interesting indeed, Dr. Hassan, and surely we must meet again to continue this very interesting discussion, and hopefully such diagnostics now will be implemented with treatment, of course.
Absolutely.
This should be the next step.
We are developing other techniques. I mean, diagnosis is one part of how to manage disease, how to manage a patient, but we are developing other technologies. We also use nanostructures to carry drug and carry this drug specifically to the cells that are infected with virus. So this is a targeted drug delivery, again nanocarriers. This will result in a reduction of the drug dose and a reduction in the side effect. The current therapeutic regimen for HCV causes severe side effect. So we're trying to work on this by targeting the drugs to the cell that needs, again using nanotechnology tools. But this is a different initiative that we are developing as we speak.
Well, on that note, Dr. Hassan Azzazi, Professor of Chemistry at the AUC, thank you very much for joining us this morning, and best of luck in your upcoming research. It seems very revolutionary and interesting indeed. Thank you very much, Doctor.
Thank you very much.
Thank you very much.
Hassan, and stay with us for more coming up on a breakfast show right after this break.
Indeed, we take a look at I Want to Know and the River Nile with Ashley Ginty. Stay tuned.